So we talked about UCCR is not a test to diagnose Cushing's, and that the features of Cushing's are cortisol excess and failure of negative feedback. So let's look at the more conventional endocrine tests that we use, and they're going to be dynamic tests, okay? Stimulation or suppression tests. From an endocrinological point of view, it makes more sense to prove failure of suppression. So in most hyperstimulatory conditions, the test is a suppression test. But obviously we do use ACTH stimulations as well. So let's look at the ACTH stimulation first. And when we kind of decided that we did half-half-ish. And do you guys just have a preference, like you use low dose dex, you use ACTH stim first, or do you sometimes modify the test you do based on the dog that you see?
I always go with low dose dex.
Okay.
I have so many dubious stimulations in the past.
Yeah.
I just abandoned it.
Okay.
So just always.
And does anyone change a little bit depending on the dog or no? No.
Not anymore.
No.
Really,
Okay. There might be reasons to do it. We'll have a look. So the ACTH stimulation test, obviously we're giving the dog a synthetic version of ACTH. Okay, so we're cranking up the ACTH, and what we expect to see in a dog with Cushing's is an over production of cortisol, so more than you would expect for a normal dog. And the sensitivity of this test is affected by the type of Cushing's the dog has. What's the most common form of Cushing's in the dog?
Pituitary.
Doesn't it depend on size? Small dog.
Yeah, well, kind of. Here's a clue. I cause it very often, probably more than you cause it.
Oh, yeah.
Iatrogenic, yeah. Okay, so the most common form of Cushing's disease is iatrogenic, okay? When you give a dog steroids, its ACTH production will go down, okay? So if you did an ACTH stimulation test in a dog that you had made Cushing's because you were giving it steroids, is going to be flat, okay? It's not going to do anything, okay? You will be picking up the steroid that you've put into the dog, but it won't respond additionally to the ACTH stimulation. Now, hopefully it's not very likely for this situation to occur in real life because the record should tell you that you're giving the dog steroids, but, you know, weird stuff can happen, right? And the two endogenous forms, as we said, okay, are pituitary and adrenal, okay? And there is a difference between these two forms of Cushing's as to the sensitivity of this test. So as you mentioned, there's a difference in the likelihood of pituitary or adrenal Cushing's depending on the size of the patient, okay? So if you have a dog less than 20 kilos, there's an 85% chance it's pituitary. If you have a dog more than 20 kilos, 50-50, okay? So it's fairly unusual to see a Yorkie with adrenal Cushing's, right? But in a boxer, pituitary and adrenal, half-half. When you're doing an ACTH stimulation test, in a dog who has pituitary-dependent Cushing's, their Cushing's is like driven by ACTH. So the pituitary lesion is producing too much ACTH, so the adrenals are primed to respond to it, okay? So we expect to pick up 85% of those dogs. In a dog with an adrenal form of Cushing's, their Cushing's is ACTH independent. Okay, the adrenal mass is pumping out cortisol. It doesn't give two hoots how much ACTH the dog has. So when you give the dog ACTH, the adrenal mass may produce more cortisol, or it may not. Okay. So if you had a dog that you already knew had an adrenal mass and had Cushing's, then you might think, probably not the best dog to be doing an ACTH stimulation test in because the sensitivity is not actually that good. Or if you had a dog where you were going to get one endocrine test and it was a large breed dog, then the sensitivity of the ACTH stimulation test is not so good in adrenal disease. You've got a higher risk of adrenal disease when the dog is larger. You know, so it might be argued that the case for a low dose dex is stronger in a large breed dog, and it's certainly stronger in a dog with a known adrenal mass. Does that make sense? Mm-hmm. So when you do an ACTH stim, the standard thing is 5 mics per kilo. Does everyone do 5 mics per kilo, or you just do half a vial or a vial? Half a vial or a vial. So for a while, maybe, was it like 3 or 4 years ago, there was a big problem with sourcing Synactin. It's not super expensive now, it's a bit more expensive than it used to be. If you don't use the half vial or the whole vial, you can freeze the rest. So depending on how your clinic works, there's quite a strong case for moving away from the half a vial thing and using 5 mics per kilo. The test does work, and it happens all the time, right? You do an IV you wanted to do IV, didn't want to do IM for some reason, it's gone perivascular, the test will work exactly the same. Okay, so you don't need to rebook the dog for another day. There's evidence to show that it works. And yes, obviously being on steroids will mess it up. Of the 2 tests that we use the most commonly for Cushing's, the ACTH stim and the low-dose dex, this one is less affected by non-adrenal illness. So if you had a dog that you thought had Cushing's but also had manky skin or whatever, you always want to think, well, can I sort the other problem out first and then come back to diagnose the endocrine test to make my findings a bit more reliable, worrying about cortisol excess and illness. But this one is less affected than a low-dose dex. So if you had a dog with another illness and you had to choose between the 2 tests, the ACTH stim might be a better choice, but I suppose the best choice would be to get rid of the other illness if you can.